Hello, doctor. I have an appointment today.
Hello, Lily. Good to see you. Please tell me how you feel.
I've been coughing for 3 days.
I see. Is the cough dry, or do you have mucus?
It is mostly dry. Sometimes it hurts my chest.
That's important to know. I will check you carefully.
I also have a mild fever.
Thank you. I will take your temperature soon.
I feel a little nervous.
Don't worry. I will guide you step by step.
Should I sit here?
Yes, please sit down. It will be more comfortable.
I hope it's nothing serious.
Most cases are mild. We will check everything carefully.
I have some questions about my symptoms.
Good. You can ask me anything.
Will the checkup take long?
Not too long. Maybe 15 to 20 minutes.
I'm a little tired today.
That's okay. Resting here will help.
Should I remove my coat?
You can keep it on for now.
I'm afraid of the examination.
Don't be. I will be gentle and careful.
Do I need to do anything before you start?
Just breathe normally and relax.
I brought a small bag with me.
That's fine. You don't need anything else.
I feel a little better talking to you.
That's good. Speaking helps you relax.
Can we start the checkup now?
Yes, we can begin.
What will you check first?
I will listen to your lungs and heart first.
Okay, I hope it's not painful.
It won't be painful. Just normal breathing.
How should I breathe?
Take a deep breath and then exhale slowly.
Like this?
Yes, very good. One more time, please.
I feel my chest moving. Is that normal?
Yes, it's normal. Your lungs are working fine.
I also have a sore throat sometimes.
I will check your throat after the lungs.
Should I open my mouth now?
Not yet. First, I will listen to your heart.
Okay. I feel a little nervous about the stethoscope.
Don't worry. I will be very gentle.
Will I need medicine today?
Possibly. But first, I need to check your symptoms carefully.
I hope the cough will go away soon.
We will do our best to help it go away quickly.
I sometimes feel weak during the day.
That can happen with cough and fever. Rest will help.
I brought my water bottle.
That's good. Drink water after the checkup.
How long will I wait after the examination?
Not long. We can decide on treatment right after.
I feel a little more relaxed now.
That's good. Relaxing helps the examination.
I want to understand what is causing the cough.
You will know after the examination. I will explain everything.
Thank you for being kind.
You're welcome. It's my job to help you feel better.
I hope the checkup is quick.
It will be. We work carefully, but efficiently.
I'm ready to start now.
Excellent. Let's begin with your lungs. Please come in, Lily. Let's start the examination here.
Thank you, doctor. The room looks comfortable.
I want to check your blood pressure first. Can you sit on the bed?
Sure. I'll sit carefully.
Place your arm here. I will wrap the cuff around it.
Okay. Is this going to hurt?
No, it will just feel a little tight for a moment.
All right, I'm ready.
Good. Now I will inflate the cuff. Breathe normally.
Like this? I hope it will be fine.
Perfect. Your blood pressure looks normal.
That's a relief. I was a little worried.
Next, I want to listen to your heart with the stethoscope.
Okay, I'll breathe slowly.
Lift your shirt slightly, please. I just need to place the stethoscope.
All right, I hope it doesn't take long.
Just a few moments. Take a deep breath in and out.
I can feel my heartbeat. Is that normal?
Yes, that's completely normal. Your heart sounds healthy.
I'm glad to hear that.
Now I will listen to your lungs. Take a deep breath again.
Okay, I hope it will be okay.
Very good. One more deep breath. Excellent.
I feel a little tickle in my throat.
That's common with a dry cough. Nothing to worry about yet.
All right, I was worried about that.
I also want to check your temperature. Please sit still.
Okay, I'll try to stay calm.
Your temperature is slightly high, but it's not dangerous.
That's good. I was worried it might be serious.
I want to look at your throat now. Open your mouth wide, please.
Like this? I hope I'm doing it correctly.
Perfect. I can see some redness. That explains the soreness.
Yes, my throat has been painful.
I will also check your ears quickly. Can you tilt your head slightly?
Sure, I've never had ear problems before.
Everything looks fine in your ears. No signs of infection.
That's a relief.
Let's check your reflexes quickly. Please relax your arms.
All right, I've never done this before.
Excellent. Your reflexes are normal.
That's good to know.
I want to ask a few questions about your daily routine.
Sure, I can answer anything.
Do you smoke or drink coffee often?
No, I don't smoke. I drink 1 cup of coffee in the morning.
That's fine. Do you exercise regularly?
I usually walk for 15 minutes a day.
Good. That helps your lungs stay healthy.
I try my best, even with a busy schedule.
Any allergies I should know about?
I'm allergic to dust sometimes. It makes me sneeze.
That may explain part of your cough.
I suspected that. Thank you for checking.
Do you have any trouble sleeping at night?
Yes, the cough sometimes wakes me up.
I see. We will discuss ways to help you sleep better.
That would be wonderful.
That concludes the basic examination.
Thank you. I feel more confident now.
Next, we will talk about what is causing your symptoms.
I'm ready. I want to understand what is happening.
Good. Let's move to the next step and discuss the diagnosis. Lily, based on the examination, your cough is caused by a mild throat infection.
Oh, I see. Is it serious, doctor?
No, it is not serious. We can treat it easily with medicine.
That's a relief. I was worried it might be something worse.
The redness in your throat shows inflammation.
Yes, it has been sore for a few days.
Your lungs and heart are healthy, so we don't need further tests.
I'm happy to hear that.
The mild fever is part of the infection. It will go down soon.
I hope it disappears quickly.
You should drink warm fluids and rest as much as possible.
I can do that. I'll drink tea and water.
Avoid crowded places while you recover.
Okay, I will stay home for a few days.
You can use throat lozenges to reduce pain.
That sounds helpful. I can buy some at the pharmacy.
Your cough may last a few more days, but it will improve.
I understand. I'll be patient.
If your fever rises or symptoms worsen, contact me immediately.
I will. I'll watch my condition carefully.
Eat light and healthy meals to help your recovery.
I will eat fruit and vegetables.
Try to sleep well and avoid stress.
I'll go to bed earlier and rest more.
Avoid smoking or smoky places during recovery.
I don't smoke, and I will stay away from smoke.
You can take mild pain relievers if your throat hurts.
Okay, I will take them only if needed.
Drink warm water before sleeping to ease the cough.
I will. That should help me sleep better.
Keep a small notebook to track your symptoms.
That's a good idea. I can write what I feel each day.
You can continue light exercise if you feel well.
I will walk slowly at home.
The cough may get worse in the morning. Don't worry.
Okay, I'll try not to be anxious.
I will give you a prescription for medicine.
Thank you. I will take it as instructed.
You should finish all doses even if you feel better.
I understand. I will not stop early.
Wash your hands regularly to prevent other infections.
I always try to do that.
Avoid very cold or very hot drinks for now.
I can drink warm tea and water.
Gargle with warm salt water to reduce throat pain.
That sounds easy. I'll do it twice a day.
Monitor your symptoms each day and note any changes.
I will. I want to recover quickly.
You may feel tired, and that is normal.
Okay, I'll rest whenever I feel weak.
We can schedule a follow-up in a week if needed.
I'll do that if I don't improve.
Avoid talking loudly to rest your throat.
I will speak softly and rest my voice.
Keep your room ventilated and clean.
I will open the window and tidy up.
Do you have any questions about your condition?
Yes. How long will the cough last?
Usually 3 to 5 days if you follow all instructions.
That's good. I hope it will be gone soon.
Take the medicine at the same times every day.
I will. I can set an alarm to remember.
Avoid sudden temperature changes. Dress warmly if it's cold.
I will wear a sweater when needed.
That covers everything for now.
Thank you, doctor. I understand what to do.
I'm glad. Follow the plan and you'll feel better soon.
I will. I feel more confident now.